Over the last 2 decades, modern biological therapies and immunotherapies have become highly adept at signaling no-go to cancer cells. We now have specific antibodies and drugs that reliably hunt down and stop malignant growth. But these precision tools have a glaring blind spot. As they target the cancer, they often inflict severe damage on the patient's healthy gastrointestinal tract. This damage triggers an immediate pharmacological response. Patients frequently experience intense bouts of nausea, vomiting, and prolonged diarrhea. These symptoms open a systemic leak that rapidly destabilizes the body's chemistry. When a patient experiences severe treatment-induced diarrhea, their total fluid volume plummets at a highly accelerated rate. The lost fluid doesn't leave empty-handed. As it exits, it drags life-sustaining electrolytes and minerals out of the patient's system. The medication fighting the disease creates a massive deficit of the chemical elements the body needs to survive the treatment. Human cellular function relies on 3 critical electrolytes: magnesium, potassium, and sodium, and chemotherapy actively wastes all 3. This diagram shows 3 minerals interacting inside a cell. Magnesium powers cellular reactions. When flushed out by chemo, the engine stutters, causing severe fatigue. Potassium governs muscle contractions and cardiac rhythm. Dehydration drains it, risking dangerous arrhythmias. Finally, sodium regulates brain and nerve function. The simultaneous depletion of these 3 minerals crashes the patient's muscular, cardiovascular, and neurological systems at the cellular level. When severe dehydration sets in, the most basic human survival instinct is to drink as much pure water as possible. But drinking massive amounts of plain water, without replacing minerals, actively accelerates the biological crisis. This simulation of the bloodstream illustrates a condition called hyponatremia, when an influx of plain water rapidly dilutes an already critically low sodium level. The remaining sodium particles are overwhelmed and separated. That drop in blood sodium concentration leads directly to persistent headaches, sudden confusion, and even seizures. During chemotherapy, reactive hydration makes plain water a catalyst for neurological failure. The standard medical approach is reactive, waiting for a deficiency to set in and treating it with an IV magnesium drip. A proactive nutritional defense strategy stops the deficiency before it starts. This diagram of blood plasma shows large protein structures called albumin. Albumin acts as the body's internal sponge, binding to water and sodium particles to lock in a stable equilibrium. Consuming a high-protein diet keeps those albumin levels elevated. This automatically regulates blood sodium and prepares the immune system to fight off infections. Fortifying the body's protein reserves is a critical first step in building a shield against the dehydration domino effect. Because cancer drugs create a highly acidic catabolic state, patients should eat alkaline-rich foods like dark leafy greens and citrus to neutralize the acid. To guard against cardiac and muscle issues, patients can pre-fill their potassium reserves by incorporating bananas, avocados, and potatoes into daily meals. At least a full week prior to a chemotherapy session, start loading up on magnesium using nuts, seeds, or dietary supplements. To hydrate safely, utilize specialized electrolyte mixes like Humalite or natural coconut water. These ensure every ounce of fluid intake is paired with the exact minerals the body is losing. Understanding the biological mechanics of depletion allows a patient to use their diet as a functional shield, protecting cellular function and maintaining quality of life during treatment.